This is the anterior apprehension test. Doctor places his hand on the patient's shoulder. This hand is placed at the distal aspect of the patient's forearm. The doctor's forearm is against the patient's forearm. As soon as the doctor touches the patient's forearm, the doctor is looking at the patient's face. Doctor abducts the patient's humerus to 90 degrees. At that point, I externally rotate the patient's humerus. I continue to look at the patient's face during external rotation and then bring the patient's arm back to their lap, continuing to look at the patient's face throughout. A positive is the patient's having a noticeable look of apprehension or alarm on their face with possible pain, indicating a chronic anterior dislocation of the glenohumeral joint.